Hi, everyone, and welcome to our fourth podcast today. We have the esteemed Dr. Samira Sarrami with us. She is an expert in her field with over 15 years of experience in medication therapy management, chronic care management, and precision medicine. She has a master's in biomedical science, a doctor of pharmacy degree, and a pharmacogenomics certification with the Mayo Clinic. She is well versed in the science of precision medicine and is instrumental in guiding both physicians and patients to optimize patient care by ensuring that it is personalized to their genetic makeup. We are thrilled to have her here with us today. Please give a warm welcome to Dr. Samira Sarrami.
Thank you, Christina, for that wonderful introduction. Once again, my name is Samira. I moved from country Iran when I was 17 years old after graduating from high school. Back then I only knew a few words of English, but it's been a long journey. So I have my bachelor's degree from University of Central Florida, my master's degree in biomedical sciences, and my doctorate degree from Midwestern University in Arizona. I'm also certified in pharmacogenomics by Mayo Clinic, and that's what's shaping my career tremendously.
That is phenomenal to hear. So you mentioned about your certification. Explain a little bit more. What is pharmacogenomics and why do you think it's a breakthrough in personalized care?
So pharmacogenomics is the study of how every patient's genetics affects the way they respond to the medications. The test is done by a simple cheek swab, just like the old COVID test that we used to do, 20 seconds in each cheek. The results would be sent to the lab. Usually we have the results anywhere between 5 to 7 days, depending on which lab we're using. And after 7 days, we get the full report. It's 18 to 20 pages, but my job is to solve medication puzzles. So I connect medications to patients to their outcome. So I pretty much go over everything. I interview with the patient, and I'm able to pinpoint and guide the practitioner and the patient to the right medication at the most safest, effective dose.
That is phenomenal. So then, can you give us an example of when pharmacogenomics changed the outcome for one of your patients?
Of course, I'll be happy to. But before we do that, I want to share something deeper. The moment that changed the course of my training, and it was a pivotal moment for me. So 15 or 16 years ago, approximately, I was a naive, eager pharmacy student in my last year of my rotations. And it was in Arizona, of course, ICU setting. And during one of the rounds, the team asked me if I could recommend patient for two patients, bed A and bed B, that had the exact same diagnosis. I was so confident back then, probably overconfident. I thought I knew all my protocols, all the guidelines. So based on that, I did my fancy calculation for the age, height, kidney function, liver function, you name it. And I was so confident. So I delivered that answer to the team. We gave the medication to both patients, and to my surprise, the medication worked perfectly for one of the patients, and for the other patient, it had severe side effect. And I was just puzzled, like, how can this be? Like, I followed all the guidelines, I followed everything by the books. So what's causing this difference, a drastic difference between the two patients? And fast forward to 16 years later, precision medicine is the answer. So I wanted to share that before I share about my story about my patients.
Well then, thank you so much. That is always a trigger point.
Absolutely.
That leads you down different career paths. So I definitely can see why it led you to where you are now. So yes, let us know about that one patient that you feel is the perfect representation of what pharmacogenomics is about.
This actually happened a couple of months ago. One of my patients, a very sweet 54-year-old female, she was complaining of fatigue. She reached out to me actually just landing on my social media, and she emailed me. She said, I've tried so many doctors, I even went to specialists, to the ENT. This dizziness doesn't go away. And she described it as, feels like I'm walking on a boat. So we did the PGX test, and the results came back, and the results showed that she was a poor metabolizer for one of the enzymes that's responsible for breaking down her beta blocker, metoprolol. So she was pretty much not breaking it down, exposing her to
more severe side
yes,
effects.
exactly. So it actually matched all her symptoms and all her side effects that she was experiencing. We changed the beta blocker, and in a matter of 4 weeks, she was a completely new person. And she was so happy. Her husband ended up being, he was very thankful. So to make the matters worse, she was also taking a pain medication. She had an injury from an incident that happened to her prior, and she was on Norco.
Okay.
And she was telling me that she feels like she's getting labeled for drug seeking because she's asking for too many refills too soon, and she's just embarrassed. So
there's that stigma. Yes.
Exactly, exactly. Norco consists of 2 medications, acetaminophen and hydrocodone, right? And hydrocodone by itself is not effective. It needs to have that activation to be converted to morphine. So if a person is a poor metabolizer, they cannot have that conversion. So it's like, think of it as they're taking a Tic Tac. It's really not working.
Yes.
So I talked to her physician. We were able to completely change the medications, use a pain medication that was skipping that whole CYP
Activation.
enzyme. Absolutely. And she was one of my really success stories that there was a sweet couple, and she was very thankful.
I can imagine. Not only do you address her dizziness, but you also address her pain. Because the worst sensation is to be on all these medications,
Absolutely.
trying your best, following the doctor's instruction, and not getting the results you want, and then to be labeled as if you're an addict. So I think you did a phenomenal job there. Thank you so much for sharing that with us.
Of course. And one of the, I'm a mother. I know you are too, Christina. I'm a mother of 2. So I can really resonate and connect with this story. It's actually a true patient case. It happened back in 2005. A breastfeeding mother was taking, I'm sure you know about this. Yes, she was taking codeine for her postpartum pain, right?
Yes.
She gave birth to a perfectly healthy baby boy. And after a couple of days, she noticed that the baby is not eating, and he was just turning, his skin color was changing. So they went to the pediatrician, and the pediatrician assured her, said, don't worry, everything is fine. A couple of days later, unfortunately, the baby passed away. It took a lot of investigation, but they found out that the mother was ultra-rapid metabolizer for an enzyme that was breaking codeine. So pretty much this was getting passed through her breast milk, and she was giving it to her baby, unfortunately, right? So, and that's the cause of the baby's death. In 2007, this happened in Canada, where you're from. So in 2007, everybody got involved, and they said, instead of doing the PGX test, let's just stop prescribing codeine for all patients, right?
Yes, let's do a broad brushstroke answer to everything, as if that is going to cure the problem. Let's just take a whole category of medication for people.
Yes. So at least, but they acknowledged it, and it's now a known fact. So we make sure we protect all the future kids and all of the future newborns from this potential harm.
Definitely, you gave great examples of how pharmacogenomics is a great tool to ensure that we address individuals and personalize their care. Why do you think that pharmacogenomics has not been more widely adopted? It's such a useful tool. What do you think is the barrier preventing it from being integrated into healthcare?
Of course. So there's 2 reasons, Christina. The first is lack of education. Both providers and patients, they're not aware that such technology exists.
Very true.
And we trust our doctors and his guidance in many levels, right? And unfortunately, the way we are taught in pharmacy school, in medical school, is a traditional way of prescribing.
Yes, the algorithm.
Of course.
Yes.
So 80% of doctor visits end up in prescribing a medication, right?
Yes.
And the way we prescribe is diagnosis, same medication to everybody.
Yes.
We expect that it would produce the same results, but that's not the case.
Yes.
They're also different. So that same medication could work for me, but it could cause major side effect in somebody else.
Very true.
Yes. So I would say the biggest barrier is education. Thankfully, in 2020, Medicare came up with a Right Drug Dose Act, and Medicare now is involved, and they're paying for this for the test. So for individuals under Medicare, the test is 100% covered, as well as Medicaid, of course. So Christina, the reality is most physicians are not aware that such tests exist, because we have not been trained in our professional training about pharmacogenomics. It just hasn't been taught. And there's hesitation that I don't have time, it's too complicated. But when I hear these things, Christina, I always tell my amazing doctors, this science is just like MRI technology. So when MRI came 75 years ago, there was hesitation, it's too costly, it's gonna cause side effects, we shouldn't do this. So just because it's expensive, just because the insurance is not covering it, that's not a good enough reason not to use it in the practical day-to-day practice.
Not to mention it is now covered and it's very affordable.
Yes. But unfortunately, you asked about the barriers. Not all the Medicare pays for it, but not all the insurances are catching up yet. So some of the private insurers may not cover it, and that may cause problems for some people, but...
And this is a one-time investment, right?
Yeah, absolutely. You're born with your genes, so you don't need to, it's not like Chem 7 that you need to go every 6 months and redo the test. This test is only done once in the patient's lifetime, and it would help guide even if you're not taking any pain medication right now, in the future, any heart medication, any pain medication, it's really huge, Christina, as you know, in psych. So with a lot of my patients, unfortunately, the ones that come to me, they have been taking 3-4 rounds of antidepressants. They've been labeled as resistant depression, right? And when we do this test for them, it just lights up like a Christmas tree. And even before they start the treatment, this is one thing that I would say the highlight of my, what I do for patients is they say, I feel hurt. I'm not crazy. The validation they get that they've changed, they switch all these doctors, and they took all these medications just as they were told. It's not all in their head. So it's not just about getting the right medication. Eventually, we want to do that from the beginning, from the start, without having to go through trial and error, frustration for the patient. They lose trust in the system when that happens, right? When you're on your six antidepressant, like you wouldn't have that same confidence about your practitioner, and this is really not their fault. This is a great tool. Right now, fortunately, we have all the data, we have all the studies to back it up. So let's use it.
Absolutely. Like you said, it's a phenomenal tool. It should be more widely used. And I'm so glad to have you here to promote it and advertise for it.
Thank you.
But let's say I'm a patient. How would I go about advocating for myself if I suspect something, or even if I'm perfectly healthy but I want to get tested? How could I do that? How could I approach my doctor and bring this up?
Patient, the most important thing I would say is knowledge is power. Get to know your condition. Do your research. The more you know, the better you can manage your disease. And what I hear from my patients a lot of times is they say, I just trusted my doctor, but it's your job That's why I never call my patients my patient. I call them my clients. So the responsibility goes on them. But they need to also do their research and get to know everything and advocate for yourself. If your doctor doesn't know, that's okay. Ask for it. It's your right to get the right treatment. If your insurance is denying it, you can work with your healthcare provider or your clinical pharmacist to get it approved. So that's the way I would go with it.
All right. Well, thank you so much. That definitely is a very key point. I think a lot of us as patients, like you said, we have this trust in our physician. When they tell us a side effect will go away with time, we're like, okay, let's just try our best and deal with it. And we don't realize that there are other tools available to us and that we could advocate for ourselves. All right, so thank you so much. There is one question left I want to ask you. I am the pharmacist here at iPharma Pharmacy. I always want to know if we're doing what we can for our physicians and our clinicians, you being one of them. Tell me, how do you feel our services align with your practice?
So iPharma has been amazing in personalizing and tailoring the medications for my practice, at least. Precision medicine, the core of precision medicine is pharmacogenomics, and it just says that we're all so different. So my patient may need a different dose that's not commercially available. That's why you guys come into the picture. You guys are amazing in pretty much anything we ask for our patients. You guys can make it happen. And for tailoring and for personalizing the medication, I would highly recommend iPharma. The staff here, including Christina, she's so knowledgeable, she's so helpful. They always go extra mile. It's not like your Walgreens or CVS. It's truly a concierge service. And a lot of clinics, as you know, nowadays, Christina, they use the buzzword personalized. We provide precision medicine because it just looks attractive to the client. But what are you really doing that would deliver that personalized care to your patient? If you're not looking at your patient's gene, if you're not tailoring the correct medication with the right dose, how are you calling this personalized care?
Very true. Yes.
But iPharma has been amazing with their staff, with just the way they treat each client from the moment everybody walks in. I always get a great feedback from my patient, and I would never send my compounding or my patients to any other pharmacy.
Well, thank you so much for your trust in us. We will definitely strive to always live up to your expectations and your patients' expectations. But truly, a real honor to have you here today,
Thank
Samira.
you so much, Christina.
It was great to hear you talk about pharmacogenomics and give us insight into that area and how we, as providers, as pharmacists, can help our patients and how they can also help themselves. Thank you so much.
Thank you so much, Christina.